Heard of the name Remdesivir lately? Well, it's an antiviral drug that was originally developed to tackle Ebola. Now, according to reports, it's showing some promise for treating the novel coronavirus. Let's find out more about this drug and the recent study. Professor Helen Rees joins us now via Skype. She's the chairperson of the South African Health Products Regulatory Authority. Professor, always a pleasure having you on the program.
Thank you for having me.
So I was watching one of the top docs in America, Dr. Anthony Fauci, the other day, talking about an early trial that shows Remdesivir can reduce recovery time. What do we know about this recent study, and what's your level of optimism with regards to this drug?
Well, I think whenever we get any clinical trial that shows promising results, it's very exciting because at the moment, as you know, we don't have a cure and we don't have a vaccine. So this was a well-done study, I understand. I haven't seen the full script, but I've read some coverage. So it was well done, and what they showed was that by putting people on Remdesivir who were in hospital and were seriously ill, they could reduce the time in hospital from 15 days to 11 days. What's not as clear yet is whether it also will have an impact on reducing deaths.
Right. So the time to recovery is reduced by about 4 days. So you potentially taking out 4 days from probably 2 weeks or so of a person being sick.
Exactly. And so that in itself is incredibly important because, as you know, as our numbers in South Africa and everywhere else in the world go up, the pressure on hospital beds is enormous, and particularly for very sick people. So the quicker you can get people well enough to be discharged and to go back into their homes, the better, because that's going to free up hospital beds. But it's also good news just for people's health. I mean, the shorter time that you can have this nasty infection, particularly for people who are very sick and hospitalized, the better.
Releasing preliminary data, Professor, on a clinical trial like this, is that unusual to you, or were these results, these prelim results, so significant that it had to be released now?
I mean, in the normal sort of way that we do business with clinical trials and the way we look at results, we usually wait until we have what's called a peer-reviewed paper. That means that the science has all been done, it's been written up, and it's been considered and thought to be good enough for publication by people's peers not involved in the study. Now, these are not normal times. We are looking all the time, and the World Health Organization is looking all the time at data that's coming out from trials as quickly as it comes out.
Right.
So before we have, the publications, people will look at the data, look at the quality of the trial, and obviously the scientists themselves are trying to publish as quickly as they can, and all the journals and online journals are putting the data out there as quickly as it can be done.
Right. And as you say, and I want to be very clear with regards to this, this drug is not a cure. It's not equivalent to a vaccine. Well,
two different things. This is a therapeutic drug for treatment. So there are different pieces of research going on. Some are looking at how do we treat people in hospital and avoid deaths? How do we treat people in hospital and get them better as fast as possible and avoid progression of the illness? We're also looking at people who are not as sick and looking for therapies that will stop them getting sicker. Stop that disease progressing so that we can avoid hospitalization and keep people as well as possible. But separate to that, we're looking for drugs that can protect people from infection, particularly groups like healthcare workers and frontline workers. And we're looking for the vaccine, which is protective. So this falls into the category of a treatment for seriously ill patients in hospital.
So we're dealing with seriously ill patients here. Currently, there's no specific treatment for COVID-19, but what I'm trying to ask is who should be really excited about these developments? Someone with a mild case of the coronavirus or people with the more severe illness?
Well, from what we know at the moment, the excitement would be to say, this shows promise for treating the severely ill end of the spectrum. Remember, most people won't get severely ill. 80% of people will either have very mild or even possibly no symptoms, or mild to moderate symptoms, won't need to be in hospital, won't require all of the things that will be done in hospital, like oxygen and supportive therapy. Right. So this is exciting for people who are treating the sickest people who require hospitalization. We don't know about this drug, whether it would have an impact on mild illness. But at the moment, it's also a drug that has to be given through an infusion. So it means that it is limited anyway in its current formulation to being administered in hospitals.
Professor, I've been reading a lot about a specific plant on social media. What do we know about the plant Artemisia? Reportedly, in Madagascar, there's an Artemisia-based herbal drink which is aimed at preventing and treating COVID-19. Have you heard anything with regards to this?
Yes, it's obviously getting a lot of attention because obviously it's got a lot of support in Madagascar and is being rolled out into the communities. So Artemisia is, you're right, it's a plant, but it's a group of different plants. But it's been known for many years to have an impact for treatment of malaria. And the Artemisia-based medicines that we use were originally from the molecules that were grown from those plants. And they're obviously modified in their formulation in medicines, but that is still a very widely used product in the treatment of malaria. So we know that it works in malaria. Mm-hmm. And what we're doing in the world generally is that we're looking at all the drugs that we know about. There are groups of people, there are dictionaries of drugs, and people are looking at all of these drugs and saying what looks like it might work to help COVID-19, either protect from infection or treat. And so the anti-malarial drugs are being looked at. We're also looking at chloroquine and hydroxychloroquine as well, and this would fall into that category. But at the moment, we don't have any definitive data that would allow us to say that Artemisia as a herbal product is effective. There hasn't been a clinical trial that would allow us to definitely put our hands on our hearts as scientists and say that this works.
How far, Professor, are we from getting a vaccine? Is it still the 12 to 18 months that we were talking about a couple of weeks ago?
A couple of weeks have gone by, so things have moved. There are more now vaccines in early clinical trials. Yeah. There's the hope in South Africa is that we will, if the approvals are given by the regulatory authority and the ethics committees, that we will soon, perhaps as soon as in May, have one of these early clinical trials being done in the country. And if there's success shown, that would go from being a smallish study with a few hundred people into expanding into a much larger study. It wouldn't stop and start, it would simply expand. But all of those, that's being considered at the moment. It'll be submitted soon to the regulatory authority, and all of those permissions still have to be sought. But as we've said before, South Africa has a very strong infrastructure for doing trials like this and some superb scientists. So we are going to be doing vaccine trials, and I suspect this will be the first of many that we will be doing.
I want to get your take on what the US President Donald Trump said the other day. He was talking about the use of powerful light on the body and the use of disinfectant via an injection. That, the latter part doesn't sound like a very good idea. It sounds rather absurd to many scientists. But from a medical point of view, Professor, is there any merit to the use of light? Because there are examples in medicine where light therapy has been used in the treatment of certain diseases. What's your take?
Well, remember that when you use light, what you're doing is you're shining something on your skin. And although the skin is an organ and it does certain things for the body that are very important, apart from protecting you, it is your outer layer. The problem with this virus is that it's getting deep into your organs, into your lungs. And so to do something that's just shining a light on the outside isn't going to be getting to the problem, which is disseminated and throughout the body.
Look, Professor, during these uncertain times, you can't help but think about one of the most devastating pandemics of the past, the so-called Spanish flu, and what people were going through back in 1918. Reportedly, South Africa was one of the worst hit parts of the world. Of course, it was a different time back then, and a lot has since changed. But are there any lessons that can still be drawn from that pandemic over a century ago?
Yes, there are. I mean, much of what we're doing now was also done then. The first thing that I think is quite important is that government leadership proved to be extremely important then, and communication from that leadership. So at the national and at local levels, if you read the reports, the heads of the equivalent of a Johannesburg in those days, were very active. And so the first thing is that you've got to have coordinated leadership at all levels, and there has to be a strong communication campaign. And some countries with the Spanish flu did this much better than others. All of the public health measures that were introduced, we're using now, the containment measures, isolation, wearing masks, staying away from people who are infected, being careful about public transport, ventilation, all of these things, if you read the reports, were also thought about then as we're thinking about them now. Other things that were done, which I think we're learning from very rapidly, was the importance of protecting your healthcare workers and your frontline working staff, but particularly your healthcare workers. That was a focus as well. And in some reports, there were also efforts to find the most vulnerable, and food security was also focused upon, because in some big metropolitan areas, particularly, the kind of devastation that we've seen from COVID-19 also occurred then. The mortality with Spanish flu was much higher than we're seeing with COVID-19, and the ability to treat wasn't as good. So we're in a much better space with COVID-19, but lots of lessons that we can learn from that response.
We're told is working. A lockdown is essentially, I guess, about reducing community transmission. But would you say the real battle lies ahead? Is this the calm before the storm?
Yes, look, the lockdown did what it was intended to do, which was to flatten the curve. And it also has given us time to get the health services prepared, to get many of the other social requirements, feeding schemes, masks for people who can't afford them, etc. It gave us this time to really build that up. But you're quite right. We're very concerned that as we lighten the lockdown requirements, that we are going to see possibly quite a big jump in numbers. We also anticipate that the numbers are going to start going up to that highest point, which is going to be, according to modelling, either in between July and September, where we're going to have the highest numbers of patients.
So, having said that, look, it's been a tough month for many. I'm sure you would agree. What is your advice to people who are just sick and tired of staying at home, COVID fatigue, who are frustrated that they can't resume normal life? Some have taken a pay cut this month. Some have, or potentially could lose their jobs. Some are saying we're ready to take our chances with this virus. Why should they stick to the regulations? Why should they listen to government? Why should they listen to the medical experts?
It's very hard. And I think we're going to have to focus a lot on people's mental health, because all of the anxieties that you just described, people are going to be living with them. What we've observed and what we would anticipate is that if this pandemic shot straight up with that big, steep exponential climb, in fact, the disruption to our society could be much greater in terms of destroying jobs, destroying incomes, destroying businesses. So part of this is to say, we know we've got to get back to work. We want to keep jobs. It's critical for us. But what is the best strategy here? And what the government is doing is to try and slowly and carefully and responsibly get key businesses to reopen over time. And everyone is very mindful of the impact on people's mental health. The one thing I would suggest to people who are finding that this is really hard going is this opportunity to do exercise between 6 and 9.
Yeah.
If you can get out, I mean, today is a sunny day. If you can get out into the sunshine, if you can walk, if you can put your heart rate up, if you're fit enough to do that, if you can run, wear a mask when you do it, keep social distance as you do it. But actually, exercise is one of the best things we know for mental health. It really changes the chemicals in your brain and makes you feel better. So I would really encourage people to take that opportunity, but do it responsibly.
Professor Helen Rees, our mission here at the SABC is to break down the science so that people can understand the challenges that currently exist and also the progress that is being made. And we know how busy you are on a Sunday especially. As always, we appreciate you making the time for our viewers. Stay well, be safe.
Communicate is essential. Thank you.